Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
Is on.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 22nd of December, 2021. I am Les Roy Williams. Thank you very much for joining us for our briefing today. I first would like to invite to the podium Dr. Cameron Wilkinson, the Medical Chief of Staff at the Joseph N. France General Hospital, to give us a presentation.
You went straight to the point. I said you went straight to the point. Good afternoon, everyone. This, I believe, is our last briefing for the year 2021. And I want to end with a stern warning. A fourth wave is inevitable and can be severe and deadly, but we are not helpless. We need to give ourselves the best protection by getting vaccinated. We also need to give ourselves extra protection by getting the booster if 6 months have passed since our last shot. Our 12 to 17-year-olds still remain vulnerable, with only about 13.4% fully vaccinated. It is therefore our children who will mainly be affected by the fourth wave, but it's the vulnerable adults who likely will die. We have had 28 deaths in the last waves, many unvaccinated and avoidable. Let us all have a great Christmas and Carnival, but give ourselves the best chance of a great New Year by going out and getting vaccinated. We have been dealing with an unprecedented situation for which there was no precedence, that is the COVID-19 pandemic. We have seen significant success in the management of this virus as compared to many nations, great and small. We have been able to successfully contain 3 waves without overwhelming our healthcare system, keeping our hospitalizations and death due to COVID-19 to a minimum. I have been honored to have had the opportunity to work with a great team that helped us to see the success that we've had thus far, moving from complete closure of our borders and lockdowns to near full opening of the country with no quarantine for the vaccinated. I first want to thank the people of the Federation for heeding the call and overwhelmingly abiding by the use of the non-pharmaceuticals and coming out in great numbers to be vaccinated voluntarily, helping us to achieve an adult coverage of over 75% being fully vaccinated. I want to thank the Prime Minister and his cabinet for giving us the latitude to make decisions with the management of this pandemic solely based on facts and science. It has also been a pleasure working with two ministers of health throughout this pandemic. First, the Honorable Wendy Phipps, followed by the Honorable Akila Byron Nisbet, and of course our Attorney General, Mr. Vincent Byron. It was also a pleasure working with all the members of the task force and those of the NEOC headed by our Mr. Abdias Samuel, and of course our host, Mr. Lesroy Williams. I want to wish everyone a Merry Christmas and a happy and safe New Year when it comes. There is one who I must give special mention, however. We are indeed fortunate to have as our Chief Medical Officer at this crucial time in our nation's history, Dr. Hazel Laws. I was honored to have worked with her over these last 2 years, in particular, in the fight against the deadly COVID virus. I want to present her a small token of my appreciation. This is an album that captures the journey we have had over the last 18 months. Contained in this album pictures from our many meetings, briefings, and presentations, and many of the speeches that she would have given. And I have it signed, presented to a true colleague and friend, Dr. Hazel Laws, in recognition of your fight against COVID-19, more so your leadership and team spirit displayed throughout, from Dr. Cameron Wilkinson, Medical Chief of Staff. Congratulations.
Thank you, Cameron. Cameron.
Then we can open to one of them. No, it doesn't have to be the first page. We have many pictures that we can open to.
Thank you. Yeah, he's finished.
What's that?
Yeah.
Oh, you
Wow, I'm speechless. I'm lost for words. But I would just say thank you, Dr. Cameron Wilkinson, for this token of appreciation. And it has been my pleasure working with you in our response to the COVID-19 pandemic. And I'm very appreciative of the support that you've provided me over these past 2 years. I want to thank you too.
Thank you very much, Dr. Wilkinson, for your presentation and your kind words and gesture. I now would like to invite Superintendent Cromwell Henry to give us his presentation.
Good afternoon, all. And as we enter the peak of the festive season, it is fitting for us to continue to remind you of the safety and health risks that poses a threat to us all. This threat is further exacerbated by new and emerging COVID-19 variants. One thing that has remained constant, however, is the mode of transmission of the virus, close person-to-person contact. There are simple ways, however, to mitigate this risk. Apart from vaccination, as strongly recommended by health authorities, the COVID-19 Prevention and Control Act, as well as the COVID-19 Emergency Powers Regulations, provide a set of prevention and control measures that are intended to prevent the spread of the virus. For persons who are planning entertainment or social events, Regulation 7 provides some guidance on this process. A person or organization may host an entertainment event in a building, club, stadium, or other similar building. The host or management of an entertainment event shall apply to the Commissioner of Police at www.police.kn for permission to host an event. The Commissioner of Police may, in consultation with the Chief Medical Officer and the Chief Fire Officer, grant permission to a person to host an event. Where permission is granted to a person to host an entertainment event, all patrons shall be required to produce proof of full vaccination by presenting their COVID-19 vaccination record or other valid proof of vaccination authorized by the Ministry of Health before entry into the event. The total number of persons that may be permitted to attend inside the building or stadium is a maximum of 75% capacity, with one person for every 6 square feet. All persons shall adhere to social and physical distancing protocols. The management shall ensure that an accurate record of all persons in attendance at the event is kept, including their name, address, telephone number, and patient number on the COVID-19 vaccination record card. The police and compliance team will continue to monitor events for compliance. Section 4. Section 4.4 of the COVID-19 Act gives this authority. A compliance team may visit or inspect any business, enterprise, or office, monitor any social event, and issue fixed penalty notice for non-compliance with the regulations. I remind you that the minimum fine is $500 for breaches, and this can be applied to the host of the event or any person who attends or visits the event, provided it is in breach of the regulations. As we close out 2021, on behalf of the Commissioner of Police and ranks of the Royal St. Christopher Nevis Police Force, I wish every one of you a safe and incident-free carnival season. I also wish to remind you, as you celebrate, to always adhere to the COVID-19 prevention protocols. Wear a face mask when in public, practice good hand hygiene and sanitization behavior, maintain a physical distance of 6 feet from others where possible, and more importantly, avoid crowds and crowded places. Thank you.
Thank you very much, Superintendent. I now invite Chief Medical Officer Dr. Hazel Laws to give us the Health Emergency Operating Committee situation report for today.
Good afternoon, thank you, Mr. Williams, and a warm good afternoon again to everyone. HEOC situation report for this year, 2021. Now, over this past week, December 15th to 21st, we added 12 newly diagnosed cases of COVID-19 to our COVID-19 tally. Over this same week, we've had 2 hospital admissions, and we are happy that these 2 individuals have since been discharged, and we've had 7 recoveries. So these 12 cases bring our total to 2,809 confirmed cases. All right, and so the Federation so far have reported 2,809 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate, with 2,769 cases being recovered over the time period. And so at present, we are currently monitoring 12 active cases. 3 on the island of Nevis, and 9 cases on the island of St. Kitts. And to date, we've only reported 28 COVID-19 related deaths. And as I said before, at present, there are no hospital admissions for COVID-19. The 28 COVID-19 related deaths, of these 28, 24 or 86% were unvaccinated. And so I usually pause at this time to reach out to those who are unvaccinated amongst us to come forward and accept the vaccine, because it provides you protection against moderate to severe COVID and even death. So the unvaccinated amongst us, we want you to recognize your vulnerability and come forward in terms of accepting the vaccine. Of the 2,809 confirmed cases, 70% were unvaccinated. And so if you're unvaccinated, you're at risk of picking up COVID, even more so now with the 2 variants of concern in circulation, meaning the Delta and the Omicron. And you are also at risk of being hospitalized and becoming severely ill. Over these past 10 months, we've rolled out our COVID-19 vaccine program, and to date, 81.1% of the adults in our population are covered with the first dose. 75.2% of the adults in our population are fully vaccinated, and we are happy about this. Now, in September, we rolled out the Pfizer vaccine for the teenagers 12 to 17 years, and to date, 15.8% of these teenagers have accepted the first dose of the vaccine, and 13.4% are fully vaccinated. In terms of the booster shot, 4.4% of the adults in our population have already come forward and are boosted. They've received their booster dose. And that, based on the data, that would provide them additional coverage or layer of protection against either the Delta or the Omicron variant. So at this time, I want to speak to the older adults amongst us, those who are 60 years and over, and those who are chronically ill, meaning the older adults who are diagnosed with diabetes, hypertension, kidney disease, heart disease, and any of the other chronic diseases that would affect your immune system. You are vulnerable and you are at risk. And so if perchance the Delta or the Omicron variant comes into our country, you will be at risk. And so if you are not yet vaccinated, we want you to come forward. And if you are already vaccinated with your first 2 doses, you can. And if 6 months has elapsed between the second dose and present, you can come forward for your booster shot. It's very, very important at this time because we are expecting a 4th wave. We are also reaching out to persons living in long-term care facilities, so the Carding home, the other Golden Age homes, and even the prison community. So if you are not yet vaccinated, please raise your hand and reach out to those in charge so that they can help you access the vaccine, because it's readily available to all who are in need. 54% of the total population is fully vaccinated so far, and this is good. And so, but we have work to do. We have an additional 46% of the population to reach in terms of vaccination. So what does this really mean? If you look at CNN, BBC, you would realize that the Omicron variant is spreading rapidly throughout North America, the United Kingdom, Europe. And so if perchance it is imported into the Federation, 46% of our population is at risk of picking up the virus. And so the threat of a 4th wave is real. The booster dose is available to all persons 18 years and over who would have received their primary vaccine series at least 6 months ago. And as I said before, I listed out those individuals who we deem at risk and vulnerable. So we want you to do a self-assessment. If you are not yet vaccinated, what can you do? What's in your power? What can you do to provide some level of protection, fighting chance against exposure to the virus? COVID-19 testing, it's the hope and the endeavor of the Ministry of Health to provide more testing opportunities or, testing sessions where persons who are experiencing symptoms, COVID-like symptoms, can come and get their swab taken to be tested. So for example, over this past weekend, over 1,340 persons landed. They came into the Federation from our source markets, the United States, United Kingdom, Canada, further afield. So if you just landed in the Federation and if perchance you are experiencing any COVID-like symptom, we want you to reach out to us to get your swab taken and be tested. We want to pick up any positive case as soon as it manifests itself. Now, in the Ministry of Health, we've been receiving a number of questions. When will students at the Bastia High School, when will students at the Washington Archibald High School be allowed to go back to all-day school? So when will all-day school resume? So I just wanted to highlight the student population of the Bastia High School, 700, Washington Archibald High School, 800. I'm doing this because the average class size at Bastia High School and at Washington Archibald High School is at about 30 to 34 students per class. And as you know it, we speak about physical and social distancing as a preventive measure for COVID. Now, the classroom space has not expanded. And so this is a critical factor as we move forward and prepare for the second term of the academic school year. So when will all-day school resume? The answer to that question depends on school safety. When we refer to school safety in the context of COVID-19, what do we really mean? Okay, so in the school setting, we want students, teachers, and the support staff, the auxiliary staff, to adhere to all the COVID-19 prevention measures, wearing of the face mask, adequate hand sanitization before entering school, during school hours, and after school, physical and social distancing. However, when you have schools like Washington Archibald and Bastia High School with a high population, an average 34 students per class, we may not be able to depend on physical and social distancing to reduce the risk of exposure to the virus. What do we have to depend on? We have to depend on the vaccination coverage of all teachers. We have to depend on the vaccination coverage of the auxiliary staff and the support staff. And we have to depend on the vaccination coverage of the teenagers, the 12 to 17-year-olds attending our secondary schools. So as we approach the second term of this academic school year, it would be nice if the students, 12 to 17 years, they come on board in terms of being vaccinated. So let's say come, for the rest of December, a significant percentage of these students come forward, receive the first dose of the Pfizer-BioNTech vaccine, and then within 21 days, the second dose. The safety within our schools will be ensured. And then the risk of exposure would be reduced. And then we can easily resume all-day school at all the schools. So school safety is of essence within the Ministry of Education. If the Delta or Omicron variant is introduced into the Federation, it will impact the vulnerable amongst us. It will impact the at-risk individual amongst us. It will impact the unvaccinated students. Yeah? A few months ago, we pleaded to parents and guardians to come forward and accept the vaccine. And we are happy and we congratulate those who have done so. As of September the 1st, when we received the Pfizer-BioNTech vaccine, we got that additional ammunition in our bag, whereby we can offer the vaccine to the teenagers themselves and offer them a level of protection. And so the greater the coverage rate amongst our teenagers, the safer our schools will be. So if Delta or Omicron variant comes at present, it will impact our students. It can impact classes. Classes may be disrupted. So ladies and gentlemen, we must do all we can to prevent school closure in the future. In the meeting that I had with the Permanent Secretary of the Ministry of Education and the leadership of the Ministry of Education, I was advised that it's important, it's critical that we protect and guard instructional time in our schools. When you look at the science and the literature with respect to the negative impact of school closure on academic achievement, it's significant. So the literature tells us that school closure has a negative impact on academic achievement. And this is more so for students from families of a low socioeconomic status. And so we really want to protect and guard instructional time during school. The ministry also notes an increase in the dropout rate of students aged 16 years and over. So it's very important that we protect and guard instructional time. How can we do so? By ensuring school safety. School safety is the way to protect instructional time. So as we approach January 10th, which is the start of the second term of the academic year, we want parents and guardians and all the stakeholders with respect to Ministry of Education to recognize the importance of school safety in this context. So we are speaking about the COVID-19 prevention and control measures, students, teachers, auxiliary staff members wearing their face mask, the importance of hand sanitization in the school setting, and the vaccination coverage amongst teachers, that's important, the vaccination coverage of auxiliary staff, and the vaccination coverage of our teenagers, 12 to 17 years. These, my friend, are the measures that will ensure school safety in the context of COVID-19. The Delta variant is still the most prevalent variant in circulation globally. The Omicron variant came to the fore towards the end of November and is impacting an increasing number of territories worldwide. It is spreading rapidly. What do we know to date about Omicron, the Omicron variant? Based on the latest scientific information, we are told that it seems to be more transmissible as compared to the Delta variant. And so the Omicron variant is more transmissible than or compared to the Delta variant. So what does that mean? So that means if one individual picks up Omicron, that individual has the potential of spreading the virus to a number of individuals. What else do we know? The current detection measures for diagnosing COVID are still able to pick up Omicron. So the RT-PCR test is still able to diagnose COVID in individuals impacted by Omicron, and the rapid antigen tests are still able to detect COVID in these persons. Now, in terms of the severity of the disease caused by Omicron, the jury is still out on that. So in other words, some anecdotal studies are suggesting that the disease caused by Omicron is less severe than the disease caused by Delta. Other studies are saying otherwise. And so to date, we are not absolutely sure with respect to the level of severity of the disease caused by Omicron. So what's the way forward? Ladies and gentlemen, as we approach Christmas on Saturday this week, Boxing Day, and the various public holidays, as we approach our Christmas Day luncheon where families and friends will be gathered together, as we approach our carnival functions, most of them are virtual, but persons will be gathering nonetheless. What are the measures we have that will prevent, delay a fourth wave? What are the measures you and I can take to reduce our risk of exposure to the virus? The wearing of the face mask, very, very important. And so as we approach this season, we need to remember that we need to keep on our face mask as much as possible. So even if we are socializing, keep on your face mask as much as possible. This is a picture of Santa bringing a face mask. We need to remember to wash our hands, sanitize our hands before going to our Christmas lunch on Saturday, before going to that social event or function or family gathering. We need to sanitize our hands before going, while there, and after leaving. We also need to remember to keep our hands away from our face, our eyes and nose and mouth. These are some basic measures that can prevent an outbreak, even at this time. Ventilation. So come Saturday, Christmas Day, we are all going somewhere for Christmas lunch. So those of us who are planning these luncheons and family get-togethers, let's secure a space in the house that's well ventilated. You have natural air flowing in all directions. So, and also when you are inviting your relatives and friends to come by, be careful about the numbers of individuals you are inviting. All right? So if your space can hold 10 persons, don't invite 30. So these are the little measures we want you to take and bring on board as you approach Christmas and Carnival. What do I say about social distancing as we approach Christmas and Carnival? All I can say is calculate your risk. You're going to get invitations to come by, to go here, attend a function, do a risk analysis. How many persons will be there? How, what are the factors related to the function to which you are invited? And, calculate your risk of exposure and make a wise decision. Do you attend? Do you not attend? And if you do, wear your mask and sanitize. Have your hand sanitizer. And you can attend a function and still maintain that safe space between yourselves and others who are also attending the function. So just keep COVID at the back of your minds, but still, it's the time to be merry and happy, and so socialize carefully. Vaccination is still the best protection against COVID. So even though we are dealing with Delta, which is the most prevalent variant, even though Omicron variant is emerging and it has a lot of mutations, the scientists still say that the vaccine provides good coverage against moderate to severe disease, hospitalization, and death. So the vaccine is still provides good coverage and good protection. And so we are advising those who have not yet come on board to do so. I want to reach out to those visitors who joined us over this past week. I'm speaking to those visitors who landed from the United States of America, Canada, United Kingdom, Europe. Those of you who just landed, if you are experiencing any COVID-like symptoms, fever, chills, coughing, sneezing, shortness of breath, fatigue, sore throat, runny nose, please reach out to us. Reach out to the nearest health center, the nurse or doctor in your neighborhood. Get tested, because we need to be able to pick up all the COVID cases as soon as symptoms are manifested. Those of us who are locals, if you are experiencing any COVID-like symptoms, you need to be tested. I want to end on a bright note, and so I want to use this forum to extend warm Christmas greetings to the people of the Federation of St. Kitts and Nevis. I want to wish us all a happy new year. I want to thank the people of the Federation for coming on board in terms of all our recommendations over this past year in terms of our response to the COVID-19 pandemic. I want to reach out to those who came on board and accepted the vaccine. We want to reach out to those who are very diligent in adhering to the COVID-19 prevention and control measures. And so I wish us all a happy and a Merry Christmas and a successful 2022. Thank you.
Thank you very much to Chief Medical Officer Dr. Hazel Laws. Mr. Abdias Samuel, the Chair of the National COVID-19 Task Force, is on a well-deserved vacation, and wherever he is, we want to wish him all the best wherever he is. Mr. Samuel, all the best. I want to now come to the question and answer segment, and we have a few questions, one of them from SKN Vibes. With the arrival of the Omicron variant, which is expected, is the Ministry of Health or the task force willing to move testing from 3 days to 1 day? I don't know what he means by from 3 days to 1 day, but Dr. Wilkins.
Okay, so I assume that he means the 72-hour negative test that is required upon arrival. And I can tell you that the closer to one's arrival, one test negative, the safer we are, but we have to think about the practicality of it also. And with the widespread testing that is being done globally, most persons who are coming here will tell you that they already have a very difficult time getting a test within 72 hours before arrival. And so requesting a 24-hour negative PCR test before arrival is synonymous to almost closing our border, because there are very few persons who will be able to meet that turnaround time. And so that is not a practical solution at all. And so we will continue with the negative PCR test that is required 72 hours, within 72 hours of arrival. But whether it is Omicron or Delta, the way you protect yourself is by going out and getting vaccinated. The way you protect yourself is by getting the booster. If you're due a booster, the way you protect yourself is by doing the socially responsible thing and wearing a mask and social distancing and making sure that your hands sanitize. That is how we're going to prevent Delta and Omicron and all the other variants that will come along from having a serious effect on us.
Thank you, Dr. Wilkins, for answering that and for clarifying the question that was presented. This next question is from SKN Newsline. Regarding local sports, more specifically football, will there be a policy governing the resumption of sports? Will the task force require the footballers and club officials to be fully vaccinated before leagues are resumed?
We have been in contact with all of the presidents of the various sporting associations across the Federation of St. Kitts and Nevis. We have said repeatedly that contact sports, it's a high-risk event in that the risk of transmission of the virus during close contact sports, where, for example, in football, you are huffing and puffing in persons' faces, etc., the risk of transmission is significant. And those events can easily become super spreader events. We also saw in our last wave that the majority of persons who were being infected were the young, and the young who were unvaccinated, and the persons who were dying were the older, vulnerable persons. And so we have had meetings with the presidents, we have had meetings with the players themselves, encouraging them to go forward and get vaccinated. We cannot continue to create loopholes in the system to facilitate persons during the time when we were having increasing positive cases and we were reporting increasing deaths. No one was coming asking when we were going to start contact sporting events. We have told them, however, that there is a certain threshold of vaccination immunity that they need to have among the clubs. I think the threshold we set was 70%. And so we understand that vaccination is a journey for our persons. There are a number of persons who came forward on the first day. Some came forward 6 months later. Some are still coming forward. And so we know it might not be practical, although it is desirable that we have 100% vaccination coverage throughout the persons who play sports. But we ask that at least 70% of them come forward so that when they are playing together, there will be some threshold of herd immunity there to prevent widespread COVID-19.
Thank you. In light of the new variant, is the task force willing to consider requiring all incoming travelers to undergo a rapid COVID-19 test upon arrival to try to capture, limit the possible spread of the virus?
We believe having the negative PCR test, which is highly sensitive and highly specific for persons coming in, offer a significant protection. The rapid antigen test, the sensitivity is not that high, and so we will still miss a significant number of persons. The sensitivity will only be increased if the persons were infectious and symptomatic. And so we don't believe that adding negative antigen test requirement at the airport is going to offer us significant protection. It will just add to the bottleneck that's already there and frustrate passengers, and there will be no scientific evidence that this will offer protection to us.
That brings us to the end of our question and answer segment. Dr. Laws would like to say something.
just received a question from persons who are traveling over the next 2 weeks. They are asking, which labs will be open to facilitate their outbound or pre-departure testing. And so the Next Generation lab will be closed on December 25th. That lab will be open all other public holidays and opened on Sundays, so they can facilitate testing for pre-departure. The Avalon lab will be opened on the holidays just for an hour or two during each holiday, meaning December 25th, 26th, 27th, just for a small window, during a small window. The Quality Diagnostic Lab will be closed on December 25th, but will be open all other public holidays. And so this information is really geared to those who are traveling over the next 2 weeks, so that you can determine where you would get your pre-departure test done. The Bastia Health Center offers the opportunity for outbound sample taking some mornings. Now that facility will be closed December 25th to 27th and January 1st to 3rd. And so you won't be able to get your outbound sample taken between January 25th to 27th or January 1st to 3rd, meaning the public holidays. But that service will resume on Tuesday, December 28th and Tuesday, January the 4th. In terms of vaccines at the health center, the health centers will be closed on the public holidays. So the health centers will be closed between December 25th to 27th and between January 1st to 3rd. And so you won't be able to get your vaccines on the public holidays. So this is just some general information. Thank you.
Thank you, Dr. Laws, for wrapping up the question and answer. I would like to now invite the co-chair of the Disaster Mitigation Council, Honorable Wendy Phipps, to address us.
Thank you, Leslie. Good evening to all of our citizens and residents of St. Kitts and Nevis. I have just asked to have the podium for a few minutes, simply to state what should be obvious at this particular time of year, and that is simply on behalf of the Cabinet and on behalf of the Disaster Mitigation Council, specifically my co-chair, the Honorable Vincent Byron, the Attorney General, to indicate to the citizens and residents our gratitude for bearing with us this past year as a task force. We recognize that a lot of the measures that we would have attempted to put in place, although done for the safety of our public, might not have been well received, but sometimes bad taste in medicine is the best. But nevertheless, we are truly heartened in general by the support of the rank and file of the public in terms of adhering to the measures that we would have put in place. Every previous speaker this evening would have reiterated those measures: mask wearing, social distancing, avoiding crowds, hand sanitization, and of course the big one, which is also prophylactic and preventative in nature, and that is that as many of our people as possible should go out and get vaccinated. Now, we wish to remind everyone that these measures are always going to be the best defenses that we have in our arsenal when it comes to public health and safety insofar as this pandemic is concerned. We recognize that measures have been relaxed over time, and we would like to keep things that way, but at the same time, we want us all to bear in mind that COVID is not over. It is still something that we have to live with, but it is something that we have the potential to win over instead of it winning over us. And as we journey into the festive season, into Christmas and into Carnival and private parties, we would wish that everybody would bear these things in mind. We are asked to look after ourselves and at the same time to be our brother's keeper. So we ask for the cooperation of the public in the measures, abiding by the measures that we have put in place. I echo the sentiments of the CMO and Dr. Wilkinson that those who are safe to take the vaccine, first dose, second dose, booster shot, whatever is the case, please go out and do so. It was rather concerning to listen to BBC, especially this morning, as we took in the statistics that are circulating throughout the UK. Even though the rest of the UK might be lagging behind London, it's only a matter of time before the others get caught up. And if I'm not mistaken, I think within the last 48 hours, they would have passed the benchmark of something like over 100,000 infections. And also the rates of death would have been climbing. I think there were over 140 in terms of deaths as a result of the last 14 days or so, and a number of them would have resulted from direct hospitalization. We are also seeing lockdowns in various other parts of Europe, which is something that we are looking at. We would not want to have to return to hit the reset button like this in St. Kitts and Nevis, because as we watch the news, whatever channel, whatever form we are looking at it in, we are realizing that a lot of these measures appear to be retrogressive, but they are nevertheless important. As I said this, a number of our Caribbean jurisdictions are still struggling. Barbados is struggling, Trinidad is struggling, and we are relatively safer than they are. But that is a picture that is rather dynamic, and it can change any time. However, having said all of that, on behalf of the Federal Cabinet, on behalf of the Disaster Mitigation Council, and also the Honorable Attorney General, I wish us all a very safe Carnival and Christmas season, and a safe New Year as we go about our business and as we look forward with cautious optimism to everything that 2022 has as a potential blessing for the people of St. Kitts and Nevis. Thank you.
Thank you very much, the Honorable Wendy Phipps. I too want to add my personal best wishes to all for the Christmas and Carnival seasons, and all the best for the 2022. We have come to the end of this NEOC briefing for today. Today is the last briefing of the year. We will be back in 2022, and hopefully we will have a better 2022 with respect to the COVID-19 pandemic. Of course, as the Honorable Phipps said, that COVID and the situation is one that is dynamic. It is ever changing. But even though we want it to change for the better, so that we can at least enjoy a lot more freedom here in St. Kitts and Nevis, and hence get things back to where we were socially and economically. So thank you to all of you for joining us. I thank Dr. Wilkinson for his presentation, Dr. Hazel Laws, and Superintendent Cromwell Henry. I also thank our Public Relations Officer here at NEMA, Ms. Michelle Rodriguez, and ZIZ for their faithful service of covering these NEOC briefings. AJ is always here. He is very faithful. John James and Khalid Lake. We also thank Dr. Marissa Carty, who oftentimes assists us here at the NEOC, especially with things that are technical in relation to the HEOC situation report. We thank all of you for bearing with us and for tuning in to these weekly briefings. We understand the nature of what is happening, and so we are grateful to you for paying attention and to adhering to the COVID-19 measures. Until next year, take good care. I am Les Roy Williams.